Hello, I am Dr. Manjiri Valsangkar, Director, Bhide Hospital Test Tube Baby Center, Navipet, Pune. Today I am going to talk about one basic topic in test tube baby. What is the difference in IUI and IVF? Now we know that both these technologies are assisted reproduction technologies for patients who cannot conceive naturally. So once we know why the patient cannot conceive naturally with the help of certain sonographies and blood tests, we suggest to the patient either a basic technology like an IUI or intrauterine insemination, which is done in patients in whom the egg reserve and the sperm parameters are near normal and both the fallopian tubes are open and the uterus seems absolutely fine. The success rate of an IUI procedure is 15 to 20%, by which it means that the patient has essentially all normal parameters and in spite of trying for a year's time naturally, they are unable to conceive, and hence we are assisting them close to natural methods with a procedure as basic as IUI. Now what is done in IUI is that the patient is given certain oral medicines from second day of the period for 5 to 6 days, then followed by follicular monitoring sonography, and the progress of the follicle is tracked right from development up to maturity. Once the follicle is mature, the rupture injection for egg rupture is given, which is known as trigger. Once the egg ruptures, the sonography is done to confirm whether the egg has ruptured, which is known as ovulation scan, and at the time of ovulation, the IUI or intrauterine insemination is performed. While performing IUI, we know that the egg has ovulated. That time the husband's sperms are collected in the lab itself and a semen wash is done to separate the good quality progressively motile sperms from the bad quality sperms, debris, pus cells, etc. So the highly capacitated sperm sample is now inserted through the vagina and into the uterus, and this semen sample is injected into the uterus. Once the semen sample is injected, the sperms go and almost naturally mate with the ruptured egg and a baby is formed, and after 15 days the pregnancy comes positive. So IUI is a basic technology. In patients who have failed 3 or more IUIs, that is the time to upgrade to a test tube baby technology, and there are various test tube baby procedures, of which IVF is one of the basic test tube baby procedures. In IVF, what we do is we start creating follicles from first day of the period for the next 10 to 12 days by giving daily injections, and then an ovum pickup surgery is done under anesthesia. The eggs are taken out from the female partner, which are mated by the sperms from the male partner, either with a basic technology like IVF or highly advanced procedures like ICSI or PICC, and then the baby which is formed is cultured in the incubator till it grows for 3 to 5 days. Once the baby develops into an embryo, then this blastocyst is transferred into the mother's uterus by an embryo transfer procedure. So in IUI, we do not make a child, we just insert the sperms right across through the uterus, and in IVF, we make a child with the help of machines like ICSI or various advanced technologies, and hence the success rate of test tube baby is 3 times more than the success rate of IUI. Thank you.